Today, our topic of discussion is the vascular system. The cardiovascular system consists of the heart and the great vessels. The heart consists of four chambers: the right atrium, the left atrium, the right ventricle, and the left ventricle. The two atria are separated by the interatrial septum and the ventricles by the interventricular septum. The right atrium, it receives deoxygenated blood from the superior vena cava, which drains blood from the upper part of the body, the inferior vena cava draining blood from the lower part of the body, and the coronary sinus, which drains the heart itself. The deoxygenated blood of the right atrium now enters into the right ventricle through the tricuspid valve, and it will now, during ventricular systole, the blood will enter into the pulmonary trunk, and then by means of the pulmonary artery, will enter into the pulmonary capillary plexus of the lungs for oxygenation. The oxygenated blood will enter into the left atrium by means of the pulmonary veins and then into the left ventricle. From the left ventricle, during ventricular systole, the blood enters the arch of aorta and via its branches and the descending thoracic aorta, abdominal aorta, it is distributed through the whole body. Then the deoxygenated blood from the systemic circulation enters into the veins, the superior and the inferior vena cava, and then again to the right atrium. So we have two circulations. One is the pulmonary circulation, the other is the systemic circulation. The right side of the heart deals with deoxygenated blood and the left side with oxygenated blood.
The blood vessels consist of a closed system of tubular passages that convey blood from the heart to different parts of the body and then back to the heart. The blood vessels include the arteries, the capillaries, and the veins. The arteries are thick-walled tubes which carry the blood away from the heart. The capillaries are the exchange vessels, which are microscopic vessels connecting the arterioles with the venules, and the veins are the draining channels, thin-walled, which carry the blood back to the heart. Functionally, blood vessels can be classified as conducting vessels, distributing vessels, resistance vessels, exchange vessels, and the capacitance vessels. The conducting vessels or the elastic arteries, they help to conduct the blood from the heart to the next arteries, that is the muscular arteries. The muscular arteries, also known as the distributing vessels, these help to convey the blood to the organs and the limbs. These will further divide into smaller branches to form the resistance vessels, which are the arterioles. The arterioles further divide to form the terminal arterioles, the meta-arterioles. Meta-arterioles lead into the capillary beds. The capillaries, they join together to form the post-capillary venules, which further join together like the tributaries of the river to form smaller veins, medium-sized veins, and ultimately the larger veins, which drain into the right side of the heart. The characteristics of the arteries. Arteries are thick-walled tubes which carry the blood away from the heart. They repeatedly divide like the branches of the tree and become smaller in size. Often they are accompanied by veins and nerves and together form a neurovascular bundle. Unlike veins, valves are absent and the lumen is smaller. This is a picture showing the major arteries of the body. So from the heart, we have the ascending aorta, the arch of aorta with its branches, the brachiocephalic trunk, the left common carotid left subclavian. The arch of aorta continues as the descending thoracic aorta, the abdominal aorta and its branches, which supply the limbs and the organs. The arterial wall microscopically consists of three coats or tunics. From inside outwards, we have the tunica intima, tunica media, and the tunica adventitia. It can be remembered by the mnemonic Indian Medical Association, that is IMA. So the innermost layer is the tunica intima, the middle layer is the tunica media, and the outermost layer is the tunica adventitia. The tunica intima, that is the innermost layer, it consists of the endothelium lining it, that is simple squamous epithelium, resting on a basement membrane supported by the subendothelial connective tissue and separated from the tunica media by the fenestrated elastic sheet, that is the internal elastic lamina. The tunica media, it is the middle layer of the blood vessels. It consists of concentrically arranged smooth muscle fibers separated by fenestrated elastic sheets composed of elastin fibers. This tunica media is sandwiched between the internal elastic lamina and the external elastic lamina. So here we can see the fenestrated sheets of the internal and the external elastic lamina. The outermost layer is the tunica adventitia. It is composed of collagen fibers and it is the strongest layer. Let us now recapitulate the differences between the three layers, the tunica intima, tunica media, and the tunica adventitia. The tunica intima, it is the innermost layer. It is lined by endothelium and it is separated from the tunica media by the internal elastic lamina. The tunica media is the middle layer. It is the thickest layer consisting of circularly arranged smooth muscle fibers and separated by fenestrated elastic sheets. It is separated from the tunica adventitia by the external elastic lamina. The diameter of the lumen is controlled by the sympathetic vasomotor fibers. The tunica adventitia, it is the outermost layer. It is the strongest layer consisting of the collagen fibers. These collagen fibers, it strengthens the blood vessels. That is, it resists the outward pressure of the blood and thus prevents formation of aneurysm. This layer also contains the vasa vasorum and the nervi vasorum. From this picture, we can make out the difference between the artery and the vein. Both have three layers. However, the vein is thin-walled. In case of the artery, the tunica media is the thickest layer. In case of vein, the tunica adventitia, it is the thickest layer. Also, the lumen of the artery is narrower. That of the vein is larger. The veins have valves which are absent in case of the arteries. Let us now learn about the three types of arteries, the elastic arteries, muscular artery, and the arterioles. The elastic arteries are the conducting vessels. These are the large arteries arising from the heart, such as the aorta, the pulmonary trunk, brachiocephalic trunk, and its branches. The main function of the conducting vessels is to conduct the blood from the heart to the muscular arteries. For this, the tunica media of these arteries is predominantly made up of elastic fibers. The elastic fibers thus makes the arteries able to stretch during ventricular systole. When the blood from the heart, it enters into these blood vessels. In order to accommodate the increased amount of blood from the heart, these vessels now dilate. Next, during ventricular diastole, the blood will have a tendency to return back to the heart. But because of the presence of the aortic and the pulmonary semilunar valves, they cannot do so. So the next option is the blood from the conducting vessels enters into the muscular arteries or the distributing vessels. So the elastic arteries, they act as diastolic pump. Next is the muscular arteries. These are the distributing vessels, such as the renal artery, the radial artery, the anterior and posterior tibial arteries. That is, these vessels, they are going to distribute the blood to the organs and the limbs. So these blood vessels, the tunica media, it consists more of smooth muscles than of the elastic fibers. So they can regulate the amount of blood which is going to flow into the organs because of the ability to alter the luminal diameter by contraction or relaxation of the vessels. The elastic arteries, they have a diameter of more than 10 millimeter. The muscular arteries about 2 millimeter to 10 millimeter. The arterioles are also known as the resistance vessels, and they regulate the amount of blood which is going to enter into the capillaries. They offer peripheral resistance and regulates the diastolic blood pressure. Going back to this picture, we can see that the elastic arteries on the conducting vessels were conducting the blood from the heart to the muscular arteries. The size of the large elastic arteries is about more than 10 millimeter. Then the medium size was the muscular arteries. They are the distributing vessels. They have a size of about 2 to 10 millimeter. The distributing vessels will further divide and re-divide to form the small arteries. The small arteries with a size of 0.1 to 2 millimeters, which further divide to form the arterioles or the resistance vessels with a diameter of 10 to 100 microns, which will further divide to form the capillaries of size 4 to 10 microns. The capillaries join to form the postcapillary venules, which will further rejoin to form the small venules and the small veins. The small veins have a diameter of 0.1 to 1 millimeter, which will join with the other smaller veins to form the medium-sized veins of size 1 to 10 millimeter. These further join together to form the larger veins of size about more than 10 millimeter and back to the heart. This is a picture of the elastic artery stained with orthene. We can make out 3 layers, layer 1, 2, and 3. So the innermost layer is the tunica intima, which is separated from the tunica media by the dotted line, which is representing the internal elastic lamina. Now, the tunica media, the thickest layer, it consists of many layers of vascular smooth muscles, which are arranged as concentric layers and separated from each other by concentric fenestrated sheets of elastin. In human aorta, about 40 to 70 such layers of elastic lamina are present, and the elastic sheets are seen as wavy fibers. This is a picture under the microscope, under low magnification, and this is under high magnification. We can make out the smooth muscle cells and the elastic sheets. And over here, we can make out, these are the blood vessels, these are the vasa vasorum, which are going to supply the walls. This is the histology slide of the muscular artery. We can make out the 3 layers, the tunica intima, media, and adventitia. The tunica media is the thickest layer with plenty of smooth muscle fibers. And here, the internal elastic lamina can be made out very easily. It can be well seen because of less elastic material in the tunica media. Arterioles. The arterioles are minute branches which are just visible to the naked eye. The arterioles will progressively divide and form terminal arterioles, meta-arterioles. The meta-arterioles, they lead into the capillary bed. The meta-arterioles can also directly connect to the venules by means of the thoroughfare channel or the preferred channel. Now, new vascular supply, the blood vessels themselves, they need blood supply. So the tunica adventitia and the outer 2/3 of the tunica media are supplied by the vasa vasorum. These are blood vessels supplying the blood vessels themselves. And the tunica intima and the inner 1/3 of the tunica media are supplied by the blood in the lumen of the blood vessels. The nerve supply is via the non-myelinated sympathetic nerve fibers, that is known as the nervi vasorum. These supply the arteries and cause vasoconstriction, except in the heart, the brain, and the skeletal muscles where it causes vasodilatation. Applied anatomy, we have arteriosclerosis. Arteriosclerosis is abnormal thickening and hardening of the arterial wall. Sclerosis meaning hardening. Now, the most common form of arteriosclerosis is atherosclerosis. Atherosclerosis begins with injury to the arterial wall because of smoking, hypertension, diabetes, and altered lipid metabolism. After injury to the arterial wall, the macrophages will come to the injured area and stick to the walls of the artery and ingest the low-density lipoproteins. Such macrophages are known as the foam cells because the fat mixes with the watery cytoplasm of the cell and creates a foamy appearance. The collection of foam cells in the subendothelial tissue creates a fatty streak. Soon, the smooth muscle cells of the arterial wall migrates and covers the fatty streak, and then it is accompanied by the fibroblasts and formation of a scar tissue. The calcium ions invade the tissue and cause it to harden into an atherosclerotic plaque. The plaques can grow large enough to block the arterial blood flow and result in death of the tissue. So this is the formation of an atherosclerotic plaque. The plaque, it can ulcerate, it can rupture and lead to activation of the clotting mechanism, resulting in thrombosis and complete stoppage of blood flow into the organs. Thrombus is a stationary blood clot formed inside a vessel. The formation of an atherosclerotic plaque may trigger the clotting mechanism due to its rough surface. A thrombi may also form if the surface of the plaque ulcerates. The blood clot, that is the thrombus, it may occlude the lumen, and thus it will lead to cessation of blood flow to the organs. Thromboembolism is a condition when the blood clot breaks away from its place of origin and it gets carried to a new location. So over here we can see the embolus. It has got dislodged from the wall and is now being carried along with the bloodstream. It is traveling to the heart. It can get lodged inside the heart. It is known as the coronary thrombus, or it may enter through the pulmonary artery. It passes into the blood vessels, the pulmonary capillary plexus, where it can block the blood vessels. It is known as the pulmonary embolism. If this embolism is on the systemic side, it may enter into the brain. Then it is known as the cerebral thrombus. Coronary artery disease is a term used for atherosclerosis of the coronary arteries. Here, the lumen of the arteries is blocked by the plaque. Now, ischemic heart disease is partial blockage of the coronary arteries. When the heart is at rest, it gets enough oxygen. But during periods of exercise, it gets deprived of oxygen. This can lead to chest pain, which is known as angina pectoris. What is myocardial infarction? Here, the coronary artery becomes completely blocked by the atherosclerotic plaque or thrombus. As a result, the portion of the heart which was supplied by this vessel will die because of lack of oxygen. The dead tissue is known as infarct. Hence, heart muscle attack is also known as myocardial infarction. The capillaries are also known as the exchange vessels. The arterioles, they divide into smaller branches and give rise to the capillaries, which are lined by a single layer of endothelium. The capillaries thus connect the arterioles with the venules. They help in the exchange of nutrients and oxygen to the body cells and collect the waste products and carbon dioxide from the tissue fluid back to the venules. The capillary beds, that is the network of capillaries, are present in all regions of the body, and each supplies the needs of the neighboring cells. All the capillary beds are not in use at the same time. For example, after a meal, the capillary beds of the digestive system will be open. Similarly, during muscular exercise, the capillary beds of the skeletal muscle tissue will be open and that of the digestive system will be closed. Most of the capillary beds, they have a shunt that allows the passage of blood from the arteriole to the venule when the capillary bed is closed. So over here, we can see the capillary bed is closed and there is a passage of the blood from the arteriole into the venule. This is the thoroughfare channel or the preferred channel. We have the sphincter muscles. These are precapillary sphincters which encircle the entrance to the capillary. When the precapillary sphincters are constricted, the capillary bed will be closed, preventing the blood from entering into the capillaries. When the precapillary sphincters are relaxed, the capillary bed will be open. The larger the number of open capillary beds, the lower will be the blood pressure in the body. What are the areas in which the capillaries are absent? In the epithelial cells resting on the basement membrane, the epidermis of the skin, hair, nails, the cornea of the eye, and the articular hyaline cartilage. There are two types of capillaries, the continuous capillaries, the other is the fenestrated capillaries. In continuous capillaries, the endothelial cells are connected to each other by means of tight junctions and resting on the basement membrane. In case of fenestrated capillaries, the endothelial cells have large pores or fenestrations resting on a basement membrane which is intact. It is present in the kidney and the small intestine. The sinusoids are large, irregular vascular spaces which connect arteriole with venule or venule with venule. It is found in organs such as the liver, spleen, etc. The wall of the sinusoids is irregular and wide, and it consists of endothelial cells which have large slits or fenestrations. Also, the basement membrane is incomplete. The walls of the sinusoids may contain phagocytic cells, such as in the liver, the Kupffer cells. Due to the irregular lumen, the flow of blood is sluggish in the sinusoids that allows sufficient time for exchange of substances between blood and the tissue fluid. Veins are thin-walled vessels which carry the blood from the capillaries to the heart. Larger veins are formed by the union of smaller veins like the tributaries of a river. The lumen is larger and valves are present which prevents the backflow of blood. Veins can be classified as large veins, medium-sized veins, and the small veins. The large and medium veins usually accompany large and medium arteries. The walls consist of 3 layers, however, the walls are thinner. The tunica adventitia is the thickest layer. In case of arteries, the tunica media is the thickest layer. The difference between arteries and veins: arteries being thick-walled, more muscular and more elastic tissue. Veins are thin-walled with less muscular and elastic tissue. The lumen is smaller in case of arteries and larger and sometimes collapsed. The tunica media is the thickest layer. In case of veins, it is the tunica adventitia which is best developed. Valves are absent in arteries and present in veins. In human body, 4 types of venous systems are seen: the caval system, the portal system, the azygous system, and the paravertebral veins of Batson. The caval system drains the blood into the right atrium from the upper and lower parts of the body through the superior and the inferior vena cava, respectively. This is the portal system. The portal system is actually a part of the systemic system. Here we have, normally in systemic system, we have a single set of capillaries. So the blood is flowing from the heart, then through the arteries into the capillary plexus, and by means of the veins, it is entering into the heart. In case of the portal system, there are 2 sets of capillaries. So the blood will flow from one set of capillaries. The capillaries will rejoin to form a vein, which will again divide into a set of capillaries, which will then enter the systemic circulation by forming another set of veins. So we have a vein which starts from capillaries and ends in capillaries. So this is the portal vein. This portal vein, it connects 2 capillary beds. So we have the hepatic portal vein. The hepatic portal vein, it starts in capillaries. From the gut, it collects the nutrition from the gut, and this portal vein will again divide into capillaries to supply the liver, where the nutrients will be metabolized. So this is the portal vein starting from capillaries and ending in capillaries. There are other portal systems in our body, like the renal and that of the hypophysis cerebri. The azygous system of veins. These are those veins which are straight in course, paravertebral in position, and not accompanied by the corresponding arteries. The term azygous means without companion. It drains the blood from the abdominal and the thoracic walls. This is another picture showing the azygous system. Ultimately, the azygous vein, it drains into the superior vena cava. The paravertebral veins of Batson, these are valveless veins lying within the vertebral canal in the epidural space. It communicates with the caval system, the azygous system, and also with the portal systems. It is seen that the venous blood from the prostate, the thyroid, and the mammary glands, in addition to draining into the caval system, also drain into the vertebral venous plexus. As a result, in case of increased intra-abdominal or intrathoracic pressure, the venous blood from these organs can bypass the systemic vein and drain directly into the vertebral venous plexus. The venous blood from the prostate glands through the prostatic venous plexus, it is draining into the vertebral venous plexus, which also has communication with the intracranial dural venous sinus. Thus, metastasis of the cancer cells from the prostate gland can spread to the vertebral column and the brain. The superficial veins, they lie in the superficial fascia, and deep to the deep fascia, we have the deep veins. The superficial veins, they are connected to the deep veins by means of the perforating veins. The perforating veins, they have valves which help in the passage of blood from the superficial veins to the deep veins. The large veins are usually single. The medium-sized veins are usually double and in the form of a pair lying on either side of the medium-sized arteries. They are known as the vena comitantes, the term meaning accompanying vein. The pulsations of the arteries aids in venous return. If this perforating vein over here, if the valve of this perforating vein is damaged, it becomes incompetent, then the blood will flow from the high pressure of the deep vein into the superficial vein. Thus, the superficial vein will now have to accommodate increased amount of blood. It's a blood that is its own quota as well as that of the deep vein. Soon, the superficial vein will thus become dilated in order to accommodate the increased amount of blood. Later on, if this process continues, the vein will become elongated and ultimately tortuous. So the dilated, elongated, and the tortuous veins, because of the incompetency of the valves, is known as varicose veins. The factors regulating venous return. We have skeletal muscle pump, negative intrathoracic pressure, pulsations of the arteries, and the presence of valves. Now, negative intrathoracic pressure, it plays a very important role. During inspiration, the diaphragm contracts and it flattens and moves downward. As a result, the intrathoracic volume increases. When the volume increases, the pressure will fall. As a result, blood will now move from a region of higher pressure to a lower pressure. Thus, the blood will be sucked into the heart. Next is the skeletal muscle pump. Here we can see that the calf muscle, it will act as a pump for the deep leg veins. How does it act? In this picture, we can see that the calf muscle is relaxed, and over here the calf muscle is contracted. During contraction, the muscle, it bulges, and it causes pressure on this column of blood within this vein. When the blood column is compressed, it has two options. The blood may either move downwards or it may move upwards, but the blood cannot move downwards because of the presence of valves. Therefore, the only way the blood can move is move upwards, that is towards the heart. Thus, the skeletal muscle plays a very important role in regulating venous return. This is a picture showing the function of the valves. Here, the valves present in this vein is allowing the blood to flow unidirectionally from downwards upwards. And when this column of blood over here is trying to flow backwards, the valves are closing. In this picture, we can see the valves are incompetent, and the blood from this column, it flows back into the lower column. Here the valves, because of its incompetency, is now getting dilated, resulting in the formation of varicose veins. That is, dilated, elongated, and tortuous veins. Soon, because of the varicose veins, there will be formation of varicose ulcer. That is, the skin over the area, it lacks from nutrition and develops into it can even bleed. Next is anastomosis. It is the communication between blood vessels forming collateral channels. We have interarterial anastomosis, arteriovenous anastomosis, and we have end arteries. Arterial anastomosis takes place between adjacent arteries by their trunks, by branches and subbranches. There are two types. It may be an actual anastomosis or potential anastomosis. Actual anastomosis is when suppose there is a block in one of the arteries, the blood supply from the adjacent artery will be able to supply the tissues, and thus there is no necrosis or loss of blood supply to the tissues. So the tissue will survive. Now, potential anastomosis is the type where anastomosis exists between the vessels, but if if one of the vessels it gets blocked, this anastomosis will be insufficient to keep the tissue alive. Example is the right and the left coronary arteries. Here, the collateral circulation cannot take place, but it is said that if sufficient time is given, then these arterioles can dilate and circulation can take place. What is an anatomic end artery? Here, the terminal branches, they do not anastomose with the branches of the adjacent arteries. Thus, if the artery it gets blocked, the area supplied by it will undergo ischemic necrosis. Functional end artery, the terminal branches anastomose with the adjacent arteries, but the anastomosis is insufficient to keep the tissue alive. Therefore, if there is blockage of the artery, the area supplied by it will undergo ischemic necrosis. What is arteriovenous anastomosis? Here, the arterioles, they communicate with the venules without the intervention of the capillaries. That is, the blood will directly flow from the arterioles to the venules. This is the arteriovenous anastomosis. The shunts have thick muscular wall and supplied by the vasomotor sympathetic nerves. It is found in the tip of the nose, the fingertip, ear lobules, intestinal villi, and its main function is thermoregulation.